Dr. Jacobs, thank you for being with us today. We're excited to talk about some of the research presented at the Heart Rhythm Society Scientific Session in Chicago. Tell us about a research project involving aspirin therapy.
Low stroke risk patients with atrial fibrillation after ablation are typically treated with aspirin long-term for stroke prevention. In this study, our goal was to assess risks versus benefits of long-term aspirin therapy. We included over 4,000 low stroke risk patients with CHA2DS2-VASc scores of 0 to 2. We separated all patients into 3 groups: no therapy, aspirin therapy, and warfarin therapy. We evaluated outcomes of cerebrovascular accident and/or transient ischemic attack, as well as bleeding incidences.
So what did you find in the study?
So we found that patients that were taking aspirin therapy long-term had significantly higher risk of strokes. So we concluded that low stroke risk patients with atrial fibrillation after ablation do not benefit from long-term aspirin therapy, but are at increased risk for bleeding incidences when compared to no therapy or warfarin groups.
As a researcher, what does that tell you?
It tells me that our practices that we've been using for many years should probably change, or at least this is a really good start to start looking at how we can make that change.
And why is this so important for patients?
It's tremendously important for patients because aspirin is available over the counter and they can just go ahead and start taking and thinking that it's going to help them, but in fact they are more likely to have bleeding complications and no benefit in stroke prevention.
What are the next steps for this study?
I think our next step should be looking at the direct oral anticoagulants and seeing if there is any potential that these medications may substitute or be used instead of aspirin.
Well, great. Congratulations on your research, and thank you for being with us today.
Thank you so much.